Thank you for choosing the ABRA Abdominal Closure System, the Dynamic Wound Closure System. This video outlines installation of the ABRA abdominal device, including considerations for patients with an ostomy. Following these steps will ensure optimal outcomes for your patient. In addition to the pre-packaged ABRA system, application will require one extra-large incise drape, such as IOBAN, 20 clamps, wicking dressing such as Interdry, and adhesive skin prep. Introduce into the sterile field 10 pouches each containing 1 elastomer, 2 button anchors, and 2 adhesive button tails. Also include the cannulator, Surgifish, and the elastomer retainer and surgical retainer. Arrange the elastomers, button anchors, and button tails in 3 separate piles. Set aside the button tails for use at the end of the case and stretch the elastomers out on the tray. Finally, remove the safety tip from the cannulator and place it next to the Surgifish. To begin the procedure, place the surgical drapes approximately 10 centimeters lateral to the wound to allow for placement of the button anchors and button tails. Document the pre-installation measurements of the length and width of the wound, as well as the loss of domain height. Draw a line 5 centimeters lateral to the fascial edge of the wound on both sides. The fascia can retract further than the skin, so be sure to always mark from the fascial edge. Trim the ostomy appliance to minimize its footprint. This will then be used as a template to draw an outline on the patient. Along the lateral lines previously drawn, make initial hash marks 1.75 centimeters above and below the ostomy appliance outline. Beginning from these points, mark every 3 centimeters along the length of the wound. Next, lay a malleable retractor horizontally across the wound to make the corresponding initial hash mark. Continue making hash marks at 3 centimeter intervals along the length of the wound. Beginning on the non-ostomy side, starting at the most inferior mark, number these sequentially. Do the same on the ostomy side, noting that you will skip 3 of the numbers due to the location of the ostomy appliance. Elastomer site incisions are made using electrocautery or a number 11 scalpel blade. To create shallow, superficial nicks, piercing the dermal layer only. Caution must be taken to control bleeding, thereby preventing pooling of blood under the button anchors. Use adhesive skin prep on the wound margin and around the elastomer site incisions. This helps to ensure the incise drape remains securely in place for the duration of the ABRA therapy. Place the incise drape so it spans across the operative field, taking care to avoid wrinkles. Trim at the wound margins and around the ostomy site. Using a number 11 scalpel blade, nick the incise drape at the elastomer site incisions to allow insertion of the cannulator. Note that the holes in the incise drape should be kept small. Ensure that elastomers, button anchors, clamps, surgifish, cannulator, elastomer retainer and surgical retainer are on the tray and ready for use. Place the surgifish over the viscera for protection during elastomer insertion. Elastomer placement should commence on the non-ostomy side of the wound, starting at number 1. Cannulator insertion should be made at a 90-degree angle to the skin surface. Insert the cannulator using medium to light pressure and a 180-degree twisting motion. Insert the elastomer 1 cm through the cannulator eye. Ensure the elastomer is securely locked in place and then pull it back through the abdominal wall. Place a clamp on both ends of the elastomer to ensure it does not slip out. Continue inserting the elastomers, advancing along the wound margin. Prior to inserting the elastomers on the ostomy side, map out which elastomers will be placed 2 to 1, creating a V shape due to the missing button anchors. Typically, the V shapes will be both above and below the ostomy site. This ensures a balanced distribution of forces and more support in the midline. The cannulator and button anchors can accommodate up to 2 elastomers. Starting inferiorly, insert the cannulator and pull the elastomer through its corresponding insertion site. Both sides of the elastomer should be clamped at this time. Continue sequentially, keeping track of the 2 to 1 placements as previously determined, until all elastomers have been inserted. Next, lay the surgical retainer across the abdomen. Based on the length of the wound, determine if a second surgical retainer is required. Ensure the surgical retainer extends a minimum of 2 centimeters beyond the elastomer insertion sites. When an ostomy is present, create a flap by cutting 2 parallel lines approximately 5 to 6 centimeters apart and approximately 9 centimeters deep on either side of the ostomy location. In preparation for placement, roll up the surgical retainer like a scroll. With clamps remaining in place, gather all the elastomers at the midline and gently pull upwards. Slide the rolled surgical retainer under the elastomers. Carefully unroll and tuck it into the paracolic gutters. Fold the ostomy flap toward the midline and tuck it under the elastomers. Check that the surgical retainer is protecting the viscera at the elastomer sites and is not interfering with the ostomy. Trim the elastomer retainer, ensuring it extends the full length of the wound. Palpate the trimmed end of the elastomer retainer to ensure there are no sharp edges. Insert the elastomer retainer with the slits oriented downwards towards the viscera and slide it under the elastomers. Rotate it upright or 180 degrees, allowing visualization of the slits. Starting in the center of the elastomer retainer, insert the elastomers into the openings at the bottom of the slits. To place the button anchors, first wipe the incise drape dry of any moisture. Lift the elastomer upwards and slide the open side of the button anchor snug against it. Hold the button anchor firmly in place and lock down the elastomer at a 90-degree angle. Continue placing button anchors sequentially by row. Button anchors should be touching each other, but not overlapping, and should be perpendicular to the wound margin. Once the elastomers are locked into the button anchors, remove the clamps. It is recommended that the initial tension and subsequent adjustments be made from the non-ostomy side so as not to disturb the ostomy. Set the tension at 2 times stretch in the middle of the wound and 1.5 times stretch at the proximal and distal ends. Use an untensioned portion of elastomer as a guide. Perform the move, or manual medialization of the fascia. On both sides of the patient, place 2 hands lateral to the button anchors and rotate fingers outward with the palms facing inward. Firmly press inward and upward simultaneously. Gently rock for 10 seconds and release, taking care to avoid any abrupt movements. Repeat this action a total of 3 times. Then, adjust the elastomers if reduction in tension is observed. Adjustments should be made from the non-ostomy side. Remeasure the width of the wound and loss of domain height. If the clinician independently decides to utilize negative pressure wound therapy, place the sponge within the wound margin as per the manufacturer's instructions. Be sure that the occlusive dressing is not covering the button anchors. Cut the wicking dressing into 2 long strips, each about 10 centimeters in width. Using the button anchors as a guide, cut 5 centimeter slits into the strips approximately every 3 centimeters, so that the fabric can be slid underneath every button anchor. For the ostomy side, cut the wicking dressing into 2 pieces, so as not to occlude the ostomy, and slide into place, both inferior and superior to the ostomy. Clean and dry the skin area 10 centimeters beyond the button anchors. Holding a button tail, fold down the front edge of the release liner without exposing the adhesive. To secure the hook to the button anchor, lift the back of the anchor away from the skin. Orient the hook of the button tail at a 45-degree angle to the anchor and insert it up into the opening between the button tail lock and the silicone pad of the anchor. Twist and drop it into the slot to secure it in place. Place the button tail on the skin without adding further tension to the elastomer. Keeping the button tail firmly in position, peel off the release liner and press the button tail onto the skin, gently rubbing it down. The button tails will overlap when they are installed but may be trimmed as needed. Following these directions will ensure a superior outcome when using the ABRA abdominal closure system.